Hi, Andrew.
Hi.
How are you doing today?
I'm alright.
Thank you so much for coming in. My name is Dr. Mad. Let's go ahead and have you checked in first.
Sounds good.
Okay. Can I please have your date of birth?
January 28th.
Okay. So, perfect. I have the right chart. Can you please tell me if your address is still the same?
Yes, address is still the same.
Okay. Would you like to update your emergency contact?
No, just keep it the same.
Okay. Can I please have your social security number for security reasons?
320-49-5952.
Perfect. Okay. So tell me, what brings you in?
Well, I have flu symptoms, got a runny nose, just overall body aches and a sore throat. And I've just felt very congested over the past couple days.
Good. Sore throat, you said.
Yes.
Did you have any fever?
No fever.
Okay. And do you know if you were in contact with anybody who had the flu this year?
I'm not 100% sure on that.
Okay. Did you have any nausea or vomiting or diarrhea?
None of the above.
Okay. Any abdominal pain?
No abdominal pain.
Okay. And were you able to eat normally?
I had a loss of appetite. Big loss of appetite.
Did you lose any weight?
No. Not anything substantial.
Okay, if you stand up too quickly, do you feel dizzy?
No.
Okay. Are you taking any medicine at the moment?
No.
Okay. Are you taking any vitamins?
Yes, I am taking one-a-day vitamins.
Okay. Okay, great. So, from all the symptoms that you've been describing, I think you might have the flu or a viral infection. It's very hard to tell, but we can definitely do a test today to see if you're positive for any of the flu strains. And we'll go from there. I'll also do a medical exam to make sure that nothing else is wrong with you.
Okay.
Okay. Do you have any questions for me before we begin?
No, I don't.
Okay. I'm gonna go ahead and wash my hands. Are you having any pain right now?
No. My nose is really tickly though.
Okay. So would you say that on a scale of 0 to 10, your pain is a 0?
Yes.
Okay, great. Any discomfort around the neck area or the face?
Yes, I do feel discomfort around the neck.
Okay. Okay, let's go ahead. I'm just going to put on some gloves. Okay, so first I'm going to start by palpating your neck and your face. I want to make sure that you don't have any swollen lymph nodes, and also I'm going to go ahead and take a look inside your mouth, your nose, and your ears. Okay, so just look straight at me. Okay. I'm going to check right above your clavicle. Okay, not feeling anything abnormal. But underneath your chin, I'm noticing that your glands are a little bit inflamed. But they're both inflamed, so that's a good sign. And they're just swollen, that's what I mean. With a viral infection, it is expected, although it's abnormal, it is expected to have swollen nodules, like your tonsils. I'm able to feel, and they're a little bit bigger than normal. Okay. Okay. Nothing swollen in the back, which is good. Okay. Now I'm gonna go ahead. I'm going to take your vital signs really quick. So first, let's go ahead and check your temperature. I'm going to put this underneath your tongue. Just hold it in like that. Good. And now I'm going to put this on your finger. I'm going to check your oxygenation and your heart rate. So just relax while this monitors. Okay. Go ahead, let it go. Perfect. So your temperature is a little bit elevated. You do have a slight fever, which is in relationship to the viral infection that you're experiencing. Maybe you don't really feel it because you're on the go and it's not that high yet. Okay, and I can see here that your oxygenation is 95% on room air, so that means that your lungs are expanding properly and they're getting enough oxygen for your brain and your heart to function normally. Okay, now I'm gonna go ahead and I'm going to check your heart rate. So first I'm going to just count the beats. Okay, so your heart rate is also a little bit elevated. That can happen when you have a fever, and nothing to worry about. They're synchronized in both arms, and I would say it's about a 2+. Good. Let's go ahead and we're going to measure your blood pressure. Is this arm okay, or do you prefer something else? Okay. Okay, so I'm gonna need you to just relax this arm. Perfect. Just gonna use a stethoscope. I apologize if this is a little bit cold. Okay, so just relax. So your blood pressure is about 110/60, and that's normal. Go ahead, and I'm going to slide this off. Okay. I'm gonna go ahead and write your vital signs in your medical chart. So your blood pressure was 110/60. Heart rate was 102, just a little bit elevated. Respiratory rate was 22, also a little bit elevated. Temperature was 101.4, not very high, but definitely I think if you take ibuprofen or Tylenol will help. Okay. And your oxygenation was 95%, so that's very good. Okay, I would like to take a look inside your mouth. So I'm just going to press a little bit on the tongue and take a look back inside. So definitely I see that you're red in the back of the throat. Okay, just take a deep breath in. Relax. Okay, let's do that one more time. Okay, no purulence noted, so I don't think I'm that concerned. Just gonna ask you to open your mouth one more time. I want to take a look on the inside of your cheeks. Okay, nothing else seems to be inflamed. The palate looks good. Okay. Okay, go ahead, close your mouth. Okay. So what I would like to do now is I'm going to take a swab on the inside of your cheeks. So go ahead, open. Let me go ahead and make sure that I'm seeing what I'm supposed to do. Okay. And on the other side. Okay. Go ahead, you can relax. I'm going to send this to the lab. Okay. Now I'm going to take a look inside your nose, so go ahead, just look up for me, please. Okay. No deviated septum. Just some increased secretions. So let's go ahead. We're going to do another swab, and we're going to send it to the lab as well. So go ahead and look up. Okay. And on the other side, just a little bit ticklish. All done. Okay. Okay, now I'm gonna go ahead and I want to check your smell. I want to make sure that your smell is still intact. So go ahead, just breathe in, breathe out. Okay. Breathe in, breathe out. Okay. So I'm just going to give you a few smells over here, and I'm going to need you to identify. Can you please cover one nostril? Okay, go ahead, smell. What does it smell like?
Orange.
Orange, yes, very good. I have one more. And go ahead, cover the other nostril. Okay. What does it smell like?
Strawberry.
Strawberries. Okay, so both the nails are intact. That's really good. Okay, what I have here is a throat spray. It really helps with inflammation. And I can offer this to you as a treatment. Would you like that?
Sure.
Okay, so what I'm going to need you to do is open your mouth. Okay, and I'm just going to gently press on your tongue, and I'm going to spray 3 times. Okay, so just expect that. Okay. Okay, go ahead, swallow. Good. Okay, and I do have a nasal spray. It really helps with stuffness. Would you like to try that?
Yes.
Okay. So I'm gonna need you to look up for me. Okay. So I'm going to spray 1 time in each nair. That's 1. Just breathe in. Okay. And 1 more time. Just breathe in. And try to keep on staying like that for a little bit. Okay. Now I do have an inhaler, and all it has in it is a steroid which will help to open up your airways and be able to breathe a lot easier. Would you like to try that?
Definitely.
Okay. Okay, So what I would like you to do is to put your lips around this, just make like a perfect seal, and when I press the vial down, just pretend like it's straw, so you would be sucking some liquid inside your mouth, and try to make sure that it gets all the way down to your lungs.
Sounds good.
Okay, so go ahead, just cover 1, 2, 3. Just breathe in and breathe out. Okay. Now I would like to take a look inside your ears, because when you have a viral infection and lots of secretions, it's very common to have, first of all, a sinus infection, and second of all, an ear infection. So I want to make sure that I'm not missing any of that. Okay, first I'm going to palpate in front of the ear. Does that hurt?
No.
Okay, and now I'm going to palpate in the back of the ear. Right here we have the mastoid bone, and any pain around it could indicate an ear infection as well. No sensitivity. Perfect. So now I'm going to go ahead and take a look inside. Okay. So I'm definitely noticing a buildup of earwax. The eardrum looks perfectly normal, no signs of infection. The color that I'm noticing is pearl gray, and I'm not noticing any purulence, no redness. Okay, everything looks very good. Let's go ahead. I'm going to go ahead and check the other ear. We're going to do the same thing. First, we're going to palpate. Any pain there?
No.
Okay. Any pain in the back of the ear?
No.
Good. Okay. So I'm just going to slowly insert the tip of the otoscope inside the ear canal. Okay. So it looks good. I'm not noticing any signs of infection. Just an increase in earwax, but that's perfectly normal. The tympanic membrane is pearl gray, and overall no signs of infection, so that's very good. Okay. Finally, I would like to draw some blood. We're going to just make sure that you don't have any other abnormalities in the blood work. Would that be okay?
Sure.
Okay. So first we're gonna go ahead and start by just cleaning the area. Do you have a preference on the arm?
I think left arm could do.
Okay, so let's go ahead and just gonna go ahead and clean. Okay, I'm gonna let it air dry. Okay, this is a tourniquet. I'm going to put it right here above the side where I'm going to draw the blood from, and it's going to squeeze your arm a little bit. I feel a little bit uncomfortable, but I'm not for too long. Let's see, I always catch my glove in the side there. That's good. If you don't like needles, don't worry, you can just look the other way. You can close your eyes. Just try to imagine a good place that you usually enjoy. Okay, it's gonna be really quick. Done. Okay, and I'm going to draw just one vial. Perfect. Okay, now I'm going to go ahead and release the tourniquet. And just apply some pressure for me right here. All done. Just going to send all this to the lab. Can you please verify your date of birth?
January 28th.
Perfect. And today is November 30th. Okay. Can you please verify that your information is correct?
That's correct.
Perfect. Okay. Let me see if there's anything coming out. Everything looks very good. Okay. Do you have any questions for me? Okay. And are you feeling a little bit better after the nasal spray, the mouth spray, and the inhaler?
I feel like the inhaler did the most help.
Wonderful. Okay. So I'm going to call you with the results from the tests that we did today. If they come back positive, we're gonna have to quarantine you for 7 days at least, and I'm gonna keep an eye on you. I'll give you a call in 24 hours to make sure that you're okay.
Okay, thank you very much.
Oh, you're welcome. I hope you feel better soon.
Okay.